So, and Courtney, are you there as well?
You know, I think, Kenneth, if you want to just go ahead and launch into what you were wanting to cover, that would be great. We were on the call and just kind of briefly chatted about, you know, what the main objectives are for connecting today and just getting all on the same page, working out the kinks, getting all access to the information so that, you know, we're really ready to move on to the next step with inviting participants to come into the Y and start their workouts.
Perfect. And did you, so I emailed you the most current version of the manual, and it looks like you have it up on the screen.
I do.
Were you able to, were Courtney and Rachel, were you able to look at the manual, the newest version of it?
I actually didn't know anything changed, but I was able to pull it up.
Okay, perfect.
And I looked at it and I noticed that it was different than the other trainer manual.
Yeah, it's a lot longer, but mostly because with some feedback that I got from the group, we did the training, I added more materials in the appendix. Real quickly, I do want to go over some of the changes that will impact the way that you interact with the participants. And those changes are outlined, let me see. Where did they go? Okay, so if you look at page F2, so it's under section F, page 2, and it's under participant privacy and confidentiality. Bottom, yeah, so keep scrolling down. And participant privacy and confidentiality. So this is probably the biggest change that has happened from the time that we did the initial training. At the time of the training, my IRB told me that what the YMCA was going to be doing was not research activities. And as I continued that conversation with my IRB, they realized that actually, technically you guys are involved in research activities. So what that means is that we have to pay a little bit more attention to participant privacy and confidentiality. And the big changes are this, is that the participants, their binders have to be stored in a locked filing cabinet. Originally, I think I had said that just as long as it was in a filing cabinet or away from, you know, other members of the YMCA that were not in the study, that would be fine. And that is no longer true. So the binders have to be stored in a locked filing cabinet. And so I'm just going to leave it up to each individual branch to figure out where that filing cabinet is and what filing cabinet to use. Is that going to be a problem to do that?
That'll be fine for us.
Okay.
Yeah, I don't see a problem.
Okay, perfect. So one thing that you have to keep in mind is that the participant has to have access to this. They have to be able to get their binder whenever they need it at every session. And I think that Lynna had shared with me that I think at the downtown branch, the filing cabinets are, only the trainers would have access to the filing cabinets. Is that true for Meredith Matthews?
So we have 2 filing cabinets. One's in my office, and only I have access to it. And then there is a separate filing cabinet in our personal training office that the office is kept unlocked. So we would just have to figure out a way to keep the filing cabinet locked until somebody can let them into the file.
So is it okay if I leave it up to each branch to kind of figure out what that process is going to be?
Yeah, actually.
Going to be. Okay, cool. So the other change is that the documents that are in the participant binder, to maintain privacy and confidentiality, they can only include the participant's initials. And so that's nothing that you need to necessarily do anything about, but just know that I'm going to be making some changes to some of the documents that the participant will be given, so that way it says, participant initials instead of participant name. Right now, some of the documents say that you can write the participant's name on it, but moving forward, we can only use initials. Does that make sense?
Yes.
Okay. And then the other part of it is, so Bree, Lynn, and I had a phone call earlier this week, and our funder is a private organization. We get our money from the National Multiple Sclerosis Society. They do not require that anybody involved in the research do any sort of human subjects training. They do not require that. However, Lynn, Bree, and I thought that it might be a good idea to test it out with you, Courtney and Rachel, and Bree, to do a human subjects online training. It's free. We're going to go through it today in terms of how to register for it, and just to see how it goes. These trainings typically last anywhere from 3 to 5 hours, and you go at your own pace. And if you guys find it helpful, and if you guys think it would be worth having all of the branch point of contacts completing, then we'll require all of the branch point of contacts to do it. But we're going to start off with the 3 of you and just kind of see how it goes and see if you think it's actually worth your time. So that's the other piece to really the biggest change in the manual. Do you guys have any questions on the privacy confidentiality part of it?
I don't.
Okay, cool. So if you don't have any questions about that, then why don't we move on to, well, since we started talking about the human subjects training, Bree, would you mind if we registered you online, and then Rachel and Courtney, you can watch this process, so then the 2 of you can do this on your own.
Okay.
So there's a website that I want you to go to, so should I just tell you what that is? And then you can
Yeah, for sure.
Okay. So it's CITI program, all one word, .org/. Error? Yeah. And it should take you, perfect. So when you get to this main stage, if you look to the right, about halfway down, there's it says create an account, and then there's a gray button that says register. There's a blue box, and then it says create an account, register. And so under search for organization, you're going to enter University of Washington, and then it'll pop up on the list.
Oops, did I?
Go back, yeah. You can just go back. So, and then a drop-down list should appear, and then you should be able to, yeah, there you go. And then continue to step 2. So then enter your first name, your last name. I would say even though you have you technically have a UW email, I would use your YMCA email because that's probably the email that you use more.
Okay.
And then under secondary email, you can put your University of Washington one. Oh, and you can just write UW or uw.edu. Yeah.
My email address came out to be so weird with its breed. It's easy to remember, I guess. Okay. All right.
Okay. So continue to step 3. Okay, so then just create a username. And then create a password. And then decide what question you want and then what the answer is.
Okay, people, don't be logging into my account here since you can see. Oh.
Okay. Oh. Okay, so answer all these questions. And you are not interested in the continuing education part. And then you decide whether or not you want them to contact you for research. To your UW email.
Oops. Okay, this is the same.
Yep, your net ID is everything before the ampersand. So it's just the BRIED. Yep. And then Department Rehabilitation Medicine. And then your research role, we'll just say you're a research administrator, which is all the way at the bottom.
Okay.
Step 7. And then, yep, check that is this the first time that you're doing one of these courses?
I think so.
Okay, so then check this is your first time. And then you need to do a training in health information, privacy, and security. And yep. And then research with human subjects. And that's it. And then hit next. And then we're doing social behavioral research. And then hit next. And if you want to take health information, please make your health information. I would say go ahead and do the health information, privacy, and security course.
Okay.
Okay, finalize registration. And then you're registered. And then essentially you just go through, you click on the hyperlinks and you go through the training. And usually how it's structured is, and you can click on it if you want to see what it looks like. There are different modules. And you read a bunch of stuff, and then at the end of the part where you just read, then you take like a quiz. And you have to pass a certain number for you to actually pass the entire training. And it takes, like I said, oh, there they are. So those are the modules. And it takes anywhere from 3 to 5 hours to complete all of the modules. But it hits on some really important information. It might be a little bit overkill for you guys because you're not involved in direct research like we are here at the UW. But since you are involved in research, it's important information to know nonetheless. So yeah, so that's that. And then when you're finished, you'll have an option to save and print. You'll get like a certificate. So go ahead and like save a PDF of that and then email it to me just so that I know that you've completed it. So any questions about how to register for this, how to log in, what to do? I mean, it's pretty straightforward.
Looks good.
Sounds pretty good.
Okay, cool. And I'm not going to give you guys a timeline or a deadline to finish this because I imagine you probably have more important things to do. But I guess a general, like maybe a month, if you can complete this within a month, that would be ideal. Does that sound pretty reasonable?
Yeah.
Okay.
Very.
Awesome.
And one comment I have, Kenneth, so I think we discussed, having each point of contact at the branch completing this information, right? Or did we discuss just having Courtney, Rachel, and I? Actually, well, we're going to pilot it, right, first.
Yeah, I think we wanted to pilot it first just to kind of see what your experience was. and also to see if it's something that you think we should do. And then depending on what your response is, between the three of you, we'll either just abandon it or we'll move forward with having all of the branch point of contacts completed. So.
All right, sounds good. So I guess, keep us posted, Rachel and Courtney, and I will as well as we go through and complete this if it seems applicable to continue to have folks go through this training prior to working with folks in the branches.
Okay.
Cool, thank you. Okay, so there's that walkthrough. So let's talk a little bit about the role of the point of contact. And for this, if you could pull up, I think what would be most helpful is if you go back to the manual, and if you go to page H36, the YMCA communication flowchart. Yes, so we covered this. So this has remained the same. So there have been no changes. Well, I guess the only change is that I replaced Lina's name with Bree's name. But in terms of how it's structured, it's the same as it was when we went over it at the training in April. Again, the big takeaway with this is that as the branch point of contact, you are the center of communication. So outside of your branch, I communicate with you, the principal investigators communicate with you, and within your branch, the study participant can communicate with you, the exercise trainer and the training floor staff, they all will communicate with you as well. So you're the hub of communication for this study at your branch. The way this diagram is structured, it makes it look like you're going to be talking to a lot of people all the time, and that's not the case at all. In fact, the bulk of the work is going to be done by the exercise trainer. Your main role as the point of contact is really just to coordinate and manage the activities at your branch to make sure that everyone is on track and that people are doing what they need to do. And if questions come up, then to either answer those questions or find the answer to those questions. I imagine that this is pretty much this is very similar to a lot of the work that you already do. Am I correct in thinking that?
Yes.
It looks that way, yeah.
Okay, so this isn't like a totally new, bag of tricks or anything. So, so I'm not going to I'm not going to say anything more about that. I think the other page that might really help you is if you go up 2 pages to H34. This is your point of contact checklist. And this is really what you're responsible for doing. So every week you want to check in with your exercise trainers just to see what's going on with them, if they have any questions. And you can do this in person if they're there, or just give them a phone call or do it via email, whatever is most convenient for you. Clearly, if they have questions, try to answer them. And if you can't answer those questions, then if it's a general study-related question, you can contact me about that. If it's a question related to a participant, you'll want to contact the principal investigator, Chuck Bombardier, about that. And the reason for that is because the way we design this study is that I'm supposed to remain blinded. I'm not supposed to know who's receiving aerobic training and who's receiving the stretching and toning training. Does that make sense?
Yes.
Okay, cool. The other weekly thing that you'll be doing is, as part of the study, every participant is going to fill out an activity log, an exercise log, and they're going to do that after every session that they complete. And part of your job is you're going to gather up all of the exercise logs that were completed within a week, and you're going to scan them, and then you're going to upload them to OneDrive. And do all of the branches have scanning capabilities?
We do.
They do? Okay, cool. That's what I thought, because Lina she suggested that everybody scan them, back to them. So that's the other main thing that you'll be doing every week. Every other week, you will join in on a phone call with the principal investigator and the co-principal investigator, Drs. Model and Bombardier, and you will review all of the, basically you'll review your caseload. Everybody who's working out at your branch, you will review their progress. If any, concerns or questions come up, you'll talk about it with Dr. Model and Bombardier. If somebody for some reason is just not showing up to their sessions, you'll also want to talk about that with Drs. Model and Bombardier. There is a phone consult spreadsheet that you will use during the phone call, and that's going to be on OneDrive, and we'll actually look at it later today or later on in the webinar. Other than that, it's really just kind of duties as needed. If you need to talk to Drs. Model and Bombardier, then you'll have their contact information, so reach out to them. You'll have my contact information, so if you need to talk to me about study issues, then talk to me about that. I guess the other main role that you'll have is that as you bring in trainers to work on this study with participants, you'll want to train them before they start working with the participants. And the training could be as simple as you just handing them over the trainer manual and having them read it from cover to cover. I would suggest that in addition to having them just read the manual, for you to sit down and talk to them, so that way if they have any questions, you can clear that up. Yeah, and that's pretty much it. Miscellaneous duties as assigned as they come up. I don't think this is gonna, I think the scanning and uploading parking receipts, I think, will only apply to the downtown location. Because my understanding is that all of the other branches have parking, free parking. So Bree and Courtney, if someone starts working out at the downtown location and they end up having to pay for parking, you and we can have a separate conversation about what exactly you need to do. Because we have money set aside in our budget to reimburse people for parking expenses. So
wonderful.
Yeah. So does anyone have any questions about the checklist, about what exactly is the role and the responsibility of the point of contact?
We may be talking about this later, but just in thinking about having our trainers read through the entire manual and sitting down to talk to them to get them trained on this stuff, should we just be logging the amount of time that it takes for them? I'm just thinking as far as getting them paid for their time.
Yeah. Anytime so that's a great question, and I'm glad that you brought that up. We are not stingy with our money. So if you hand over the manual to a trainer and it takes them 2 hours to read through it, we will pay them for that time. Did that answer your question?
Okay, so yeah, okay. So are we just kind of are we just having them log their hours in our system as they normally do, and just, or should they not log those there? They should we keep this stuff separate and we send it to you? How does the payment work?
I think I can answer that, Rachel.
Yes, I was going to say, Bree might be able to speak to that better than I can.
Yeah, so the way it's going to work is basically the trainer is going to enter their hours as usual, but we then will get reimbursed from Kenneth and his team for those hours. So what we just need to do is make sure that those hours are communicated back to us at the AO so that we can invoice for them. And so, let me just chat with Lena real here maybe tomorrow and just get a solidification of exactly what that process will be. But yeah, so there won't be anything asked additional of the trainers, so just log hours as usual. It'll just be a communication piece so that we can make sure to get those hours accurately noted on the invoice.
Okay, great.
Cool. Thanks, Bree, for explaining that.
Mm-hmm.
Any other questions before we move on to the OneDrive walkthrough? Cool.
Kenneth, I'm having a question. I'm sorry, I just have a question. I'm wondering, can you paint a picture of what that first session looks like?
Yeah. So I've never been present for an actual first session, but if you want to scroll up, I think to H32. Yeah, maybe H31. Okay, or H30, maybe. One more page up. Yeah, so the first session, so this is the trainer checklist. And it literally breaks down every session that the trainer has with the participant and what they need to go over. So the first session is it's front loaded. It's a lot of just going over the participant manual. It's showing them around the facility so that way the person knows where all the equipment is, where the changing rooms are, where the bathrooms are. It's sitting down with the participant and going through the paperwork so that they can sign up for their gym membership. And the list is pretty comprehensive. I mean, to answer your question, what does that look like? It's probably going to be less physical activity and more just going over paperwork is really what that first session looks like. The participant is still expected to work out during their first session. So, and this is actually important to let your trainers know, because they're spending an hour per session with the person. If during the first session there's no way that the trainer can go through everything on the checklist and still have the person work out in under an hour, then some of the tasks in the first session they can save for the second session. Because essentially the way that we structured this is that the very first 2 weeks of a person working out, they're going to be working out with a trainer at every single session. And so the trainer doesn't have to go over everything with them during the first session. And it's absolutely okay if they do some of those activities during the second session or even the third session. So did that answer your question, Bree?
Yeah, no, thanks, Kenneth. I always just think, it's helpful to have that walkthrough just prior to finding yourself in that first meeting and kind of just
I have a little bit more of a question now. I'm curious about how, I'm assuming you guys will notify us, the point of contact, when we have a new person. So just like how does that process work? Like what will it look like to know that we have somebody? Will they come in with the materials that they need? We give them the materials, like stuff like that.
Yeah, no, that's great. Okay, so this is how it's going to be done. So we enroll a person, and then I will email the branch point of contact to let them with that person's ID number, their study ID number, saying, hey, we just enrolled this person. Go ahead and log into OneDrive. Their contact information is on OneDrive, along with their training assignments, so either stretching, intoning, or aerobic. And basically take it away from there. Assign them a trainer, and then have the trainer contact them using the script that's in the manual, and using there's a breakdown that identifies which sessions the trainer needs to work out with the participant. And I think that's on page H35. So just have the trainer follow that as a guide. Use the script in the manual to, contact the participant. Yep, there it is. So, and then basically invite them in and start working out with them using whichever protocol applies to their training assignment. So to answer your question, so I will email you to let you know when there's a new person, and then you will go into OneDrive and get that person's information and then pass it on to the trainer. Does that make sense? Yeah.
Yes. So right now we have one notebook for each type, so the stretching and the other one. So I know that they don't need a copy of that, do they? They have a participant manual.
So the manuals that you have, and I'm actually going to give you an updated version of the participant manuals. So probably either Friday or Monday, I'm actually going to drive to your branch and then swap them out. Those are for you to keep just as a reference. Those are not for you to distribute.
Okay.
So every branch should have a trainer manual, a participant, an aerobic exercise participant manual, and a stretching and toning exercise participant manual. And that's so that, the trainers, because there are going to be different trainers that are going to be working with people, and sometimes it's helpful for them to see, well, what exactly is the participant going to get? So that's just for you to keep at your branch and for you to reference. In terms of the binder that the participant will get, I think what we're going to do is after we enroll a person and they tell us what branch they want to work out at, I will inform the branch point of contact, and then I will also mail the participant binder to the branch for the trainer to give to the participant. And so with this first group of people, so we have 2 people, it's going to be a little different. Instead of mailing them, I'm just going to hand deliver them because I have to deliver other materials anyway. But moving forward, you can expect the binders to be mailed to the branch. So.
Okay, and these binders are where they will house all of their information and the things that we are supposed to be locking up. We don't need to create any extra folder or anything for them.
Nope. Yep, you don't have to create anything. So the binders, you literally, the only thing that you're going to have to print is you're going to have to print their exercise prescription, which will also be on OneDrive. And the reason for that is there's a different prescription depending on whether they're in the aerobic group or the stretching and toning group. And so I won't be able to print that for you. So you'll just have to log in and print whichever one pertains to their training and then pop it into the manual. But everything else will be there ready for the participant to use.
Okay, so when we receive this email from you, it's on us to contact the person to set up their first session.
Correct. Yep.
Okay.
And you want to do that typically, you want to do that as soon as possible. I would say, within a week, you want to contact that person. So.
Okay, and as far as of course we would want these people to probably be with the same trainer all the time, but in the instance that they're scheduled to have something and we want to stay on track and the trainer's not available, are they okay to work out with a different trainer?
Yeah, absolutely. Yep.
Okay.
Yep. I mean, try your hardest to be consistent, but we know things happen. So if you need to switch out a trainer for whatever reason, then that's absolutely fine.
Okay.
Yep. And one thing, this is in the manual, but it's worth repeating because it's a really easy detail to forget. When you schedule the sessions with the participant, and even for the sessions that the participant works out on their own without a trainer, you want to reiterate, you want to schedule those sessions for around the same time. So we don't want somebody to work out at 8 o'clock in the morning one day and then, their next session they're working out at 5 o'clock in the afternoon. We want people to stay relatively close to the same time for all of their sessions. So I would remind your trainer about that and ask your trainer to remind their participant about that as well.
Okay.
Yeah. I talked to, so everything that we're going over, or a lot of the stuff that we're going over in terms of the, the procedural stuff, I've spoken to every participant about. So they are reminded of this over and over again. That doesn't mean that they're going to remember it, because keep in mind that people with MS, they typically have problems learning new information. So it's not necessarily a memory issue, but it's just that it takes them, you might have to repeat something many, many times before they understand it. But once they understand it, then they're good to go. So just kind of keep that in mind, that some of this procedural stuff I've gone over multiple times with our participants, and you're still going to want to move over it with them because it just increases the likelihood that they'll actually learn that new information. Okay?
Okay.
Cool. These are great questions. So any other questions?
I have a whole bunch of questions. I'm sorry. Do we know about how many people we should expect? Because I think I actually might honestly need to hire another trainer.
So at the training, I mentioned that we have about 70 people that are just kind of waiting in the wings to see if they meet all of our studies criteria. I suspect that half of those people will be enrolled in the study by the end of September. So we're looking at like 35-ish people over the course of like 3 months, roughly. Keep in mind that
association-wide, right, Kenneth? So that would be 35
exactly.
people split between 13 Ys, potentially.
That's 35 people association-wide, correct. Which branches these people choose to work out at, I don't know. I suspect that the branches that will probably see a lot of traffic will be Matt Griffin. I think the downtown branch is actually going to see a lot of traffic. And so Matt Griffin, downtown, and maybe Meredith Matthews. I think those branches are probably going to be the 3 branches that will see a lot of people. But again, we won't know until we start pushing people through our screening process and get more of a sense of, where are they in their lives, like during the day, and what branch would be most convenient for them to work out at. So I can tell you this, that you will not all of a sudden receive 10 people in a week. That's not going to happen. Our screening process is it takes on average about 6 weeks from start to finish for us to determine whether or not we can enroll somebody. And people are at various stages within that process. So, I mean, if anything, you'll probably see like one person, like a new person every week, or something like that. So you'll never get like a whole huge like bunch of people at the same time. So.
Okay, and if we have like some people that we know might be interested, are they able to apply to be in the study, or is it kind of closed?
No, absolutely. If you are already working with people who you think might be a good fit, or they just want to learn more about the study, put them in contact with our research assistant, Catherine. And her email address is ksa3 at uw.edu.
And was that F as in Frank, or?
That was S as in Sam.
Oh, S as in, okay. KSA3 at uw.edu.
Yep.
Cool.
And her phone number, if they don't want to email her, they can call her toll free at 1-855-320-7926.
Okay.
Yep, and just emphasize that to whoever you give that number out to, that they have to dial the 1 before, otherwise it won't go through. So.
Okay.
Yeah. Any other questions?
I have just a comment.
Yeah.
Okay. This is Bree. I just have a comment. So, Rachel, when you were saying, feeling kind of worried about having enough staff, I think, Kenneth's point about it not being a huge influx all at once is hopefully reassuring. But then also thinking association-wide, too, that, maybe we have personal trainers at a branch who are willing to support this program at Meredith Matthews, and we can just pull from already existing resources, just maybe at other branches. So, if you find yourself in that position, just, let's talk about it and see if we can't leverage some staff from other branches, so that we're, not feeling like you're having to restart in terms of onboarding.
Okay, great. That's a good point. Thank you.
And also, and this is Kenneth. If you find that you're feeling a bit overwhelmed and you've got like 6 people that are working out and you're at max capacity and you can't pull people from other branches, I mean, that's something that you'll want to communicate on your biweekly phone calls with Chuck and Rob, and then they'll get that information back to me. And I mean, we can always revisit the schematic and come up with another plan. Just to kind of give you a little insight, so the Northwest Hospital is currently our only gym, and they got to a point where they reached their maximum capacity, and they were like, unfortunately, we can't take anybody else on right now, and that wasn't a problem. So we just held off. We explained that to some of our participants, and we just held off. So we can make little adjustments to make sure that we're not creating problems. We have a lot of flexibility, and we will exercise that flexibility if needed. So.
Okay, great.
Yeah, so hopefully, just know that we're here to work with you. We're not here to, enforce this edict on you and then, have you go crazy because you have to like find other resources and whatnot. So, yeah. So, any other questions about, just any other questions in general?
I don't have any.
Cool.
Thanks, Kevin.
Cool. Well, if you think of anything, so my contact information is in the trainer manual. Feel free to call me. Feel free to email me. Talk to Bree. Have Bree talk to me. Just if any questions come up, let me know. So I think this is the perfect time for us to go into OneDrive because we've been talking about this document will be on OneDrive and that document will be on OneDrive. So were all of you able to log into OneDrive?
Yes.
Okay, cool. And Rachel, I know
go
that
out of it and then sign back in just to show.
Yeah, just so that everyone can see what the process is. There are like a million ways that you can log into OneDrive. You can either just click on the link in the email that you received and it'll take you to the screen. I suggest bookmarking it so that way you don't have to keep going to the email and clicking on the link. You could just do a Google search for Office 365 login and it'll take you to a screen that looks like this. Again, I suggest bookmarking it. From this screen, all you have to do is enter your UW email address. You don't have to enter your password.
Voila.
Okay, so then click on, why is it that we can't see your folders? Click on, so in the upper left-hand corner it says Office 365. Click on that, and then it should give you a menu. And I guess choose your theme.
Blue it is.
Yay. You don't want the good luck cat?
Oh, wow, yeah, that's nice. Okay, save.
Okay.
I just wonder, let me go back. I can send out the link to folks, but this is how
everybody,
I would take
yeah, everybody received an email like that. But in theory, when you click on the Office 365 link in the corner, it'll open up a screen that gives you all the Office 365 options. So let's see. So hopefully it'll do it. So it looks like it's thinking. So you guys can play around with it. But basically, one of the options is OneDrive. So then you would click on the icon that says OneDrive, and it'll take you to the screen that we're looking at right now. But since you all received the email with the link, I would say just access it through that link for now. So here are your folders. You all have different permissions. Everybody has access to the phone consult folder. Everybody has access to the study documents folder. Everybody has access to the branches folder. However, you only have access to your branches folder. So if you click on, Bree, if you click on branches, you should only see the downtown folder. Yep, exactly. So when I log in, because I have full access to everything, when I log in, there's a folder for downtown, there's a folder for Meredith Matthews, there's a folder for every single branch. But depending on what branch you're working out of, you're only going to have access to that branches folder. So this is the folder that you're really going to be working out of. So if you open up the downtown branch, or if you go into it, you'll see that we have a folder for activity logs. We have another folder for exercise prescriptions, and then there's a spreadsheet for downtown. So if you click the downtown spreadsheet to open it, this is the spreadsheet that you're going to go to after I tell you that we enrolled somebody in the study. And this spreadsheet has their information. you'll notice at the bottom there are two tabs. It says Contact Information and Training Type. The Contact Information tab is basically that. It has the participant's contact information. Once the person completes their first session, we'll want you to log that, so that way we know when they actually started their program. And then once you assign them a trainer, we'll also want to know who their main trainer is. If you click on the Training Type tab, basically just two columns. The first column will actually, where it says has all those zeros, that'll actually populate automatically from the previous tab, and that'll be the study ID. And then the second column will either say aerobic or stretching. That is the training program that the person is assigned to. So it's pretty straightforward, but are there any questions about this spreadsheet?
I don't have any.
Okay, cool. So one of the features about OneDrive is that you can edit any document in OneDrive, or you can download it to your computer and then edit it and then upload the updated version back to OneDrive. You figure out which works best for you. So brief, you go to the top, kind of towards the right, it says Edit Workbook. And it gives you those two options, either edit it in Excel or edit in Excel Online. So I would say play around with it. Like if you just have like a really quick update to make, I would just say edit it online. But if you're going to make like a substantial update, then I would say download it, work on it, and then re-upload it. And it functions just like Excel. So I'm just going to assume that you guys are familiar with the Microsoft Office suite. So I don't have to go through that with you. So yeah, so then to get out of this document, yep, you can either hit the back button. There are multiple ways to do the same thing. You figure out what works best for you. You can hit the back button. You know, OneDrive, there are hyperlinks everywhere that will take you back to the previous folder. So I really think the best way for you to kind of understand OneDrive is just to play around with it. Exercise prescriptions. Let's go into that folder. So after I enroll a person into our study, I will upload their aerobic exercise prescription to this folder. The stretching and toning prescription is the same for everybody. So if somebody is assigned to the stretching and toning training, all you need to do is just print the stretching and toning prescription that you see here. Any questions about that?
No.
Okay, cool. And then the activity log is the other part of kind of like your weekly thing. And basically, you know, by end of day Monday, you want to make sure that you scan and upload the previous week's activity logs to this folder. And I think to keep it easy, I would say create a folder for each participant and keep their activity logs separate. Right now, there's nobody enrolled at the downtown location, so there's no folder. But yeah, to create, you would just click on New, and then select what new document or folder you want. Yep. Yep. So it's pretty intuitive. Bree, have you had a chance to kind of poke around and check it out? Check out OneDrive?
Just a little bit. I think this has been really informative, just kind of you blending, you know, the weekly checklist of what to do and where kind of all of those pieces are housed on OneDrive. I think you're right. You know, this is pretty intuitive, and you know, we use Outlook and Excel and Word, and I mean just Microsoft Office types of programs here at the Y pretty frequently. So I think you know, this will resonate well with our folks.
Yay. Yeah, and again, this is a Microsoft product. So, I mean, if you know how to use the Microsoft Office suite, then you know how to use all the programs in OneDrive. So Rachel and Courtney, do you have any questions about OneDrive, how to use it, how to log on, anything?
Not right now, I don't.
Okay. Oh, one thing that I do want to share with you. So if you ever edit a document in OneDrive, as you're making changes, it saves automatically. So there's no separate save button that you have to hit. So just know that.
Okay.
I guess go back to the main folder and let's look at the study document. So the study documents folder has the trainer documents, and which are for the trainers, and then the participant documents, which are for the participants. Click on the participant docs. So you will likely not ever have to print anything from here because all of these documents this is what makes up the participant binders. However, if ever you find that you need to make a copy of something, just know that these are the documents that are in the participant binder. So you're welcome to download and print and make as many copies as you want. If you go back to the main docs and go to the exercise trainer docs, this is the manual. This is the manual that I emailed to you yesterday, Bree. And this is the manual that we were looking at earlier. So if ever you need the most current version, you can always log on to OneDrive and the most current version of the manual will be there. So that's pretty much it. I mean, I don't know if I have anything else to say about OneDrive. I guess as you use it, if questions come up, just let me know and then we can talk about it. But other than that, it is what it is. It is what you're looking at.
Great, thanks, Kenneth. That's really helpful.
So before we finish up this webinar, there has been a recent change. So the participant that was going to work out at the downtown location, she has decided that she wants to work out at the Matt Griffin location instead. Because it's just closer to her home. So I'm sorry, downtown, you're not going to get a person probably for another couple weeks. But my question is, should I just reach out to, I was thinking of just reaching out to the point of contact at the Matt Griffin location. I think that's King.
Kimmy?
Kimmy, yep. And then just having her watch this webinar and then having her contact the participants and start working out with them. What do you think?
Yeah, I believe she was at the initial training.
Okay.
So I think that would be fine. And then, we can just answer any questions and be in contact for follow-up if there is anything still outstanding after reviewing the webinar.
Yeah, perfect. Cool. Well, I don't have anything else to share with you all. So does anyone have any final questions or closing comments or anything?
I don't think so. I appreciate your time, Kenneth.
Yeah, thank you. I appreciate your enthusiasm and for taking on the responsibility for being one of the main contacts for this study. It's exciting.
And if there's anything like, I don't know if we need to be helping any of the other directors or anything, I'm happy to help where I can.
Okay. Yeah, and I think, Bree, I think that's something that I'm gonna leave that responsibility up to you to kind of feel out because you have a better idea of your internal resources and whether or not, other directors need that extra push or that extra help. So you and we can talk about that as time goes on. But thank you for the offer. That's great.
Yeah, sounds good. Thanks, Rachel.
Cool. So do you feel like you are ready to start taking on participants? Do you feel like you have all of the procedural information, the setup?
Yeah, as long as you're okay with our trainer, the initial trainer that we would use to have not had this IRB testing just yet. Yeah.
Yeah, I'm totally fine with that. Yeah.
Okay.
And I think on that note too, we were also talking about, providing those trainers as just with references to that in-depth IRB human subjects trainings that you as directors might go through, but the trainers themselves might not go through that in-depth training, but that you would be able to kind of disseminate the most important applicable information to them.
Okay.
Yeah, that's a good point, Bree. So if we decide to move forward with having, more YMCA staff do the online training, it would only be the point of contact at the branches that would do it. The manual, the trainer manual, has in the appendix what's called the Belmont Report, which is something that you're going to review in the online training. The Belmont Report is kind of like the reason why we have an ethics review board regarding research, and why we have why we spend a lot of time talking about privacy and confidentiality. So I would say for the trainers, just have them skim through the Belmont Report just so that they understand like the history of why it's so important to maintain privacy and confidentiality within research studies. Yeah. So cool. Well, if no one has any other questions, I think that's a wrap. I think we're good, right?
Yeah.
Okay.
I like
cool.
it.
So Rachel, I will be in touch with you separately. Earlier I had said that I'm going to drop off some materials, and we are going to have somebody start working out at your branch. So I will also send you an email with that person's ID number. But I'll email you so that we can figure out a time where I can drop off some stuff, and so that you'll be at the branch as well.
Sounds good.
And then Bree and Courtney, I will be in touch with both of you. Once we have somebody to work out at the downtown branch, you'll also get an email. And then I will contact Kimmy to let her know that we're going to send somebody her way. Bree, in terms of the recording for this webinar, I'm wondering, do you think it's going to be like a really big file, or do you think it's something that we could email? I'm wondering.
We definitely couldn't email it, but usually what I've done, so we record a number of webinars here, and what usually works best is to upload it to YouTube and send out the link. So I can do that. It's not exactly the fastest process. It sometimes takes a long time to load, but it could be accessible probably by tomorrow afternoon at least, at the very latest.
Perfect. That would be great. So I will hold off on. Okay, perfect. So once you upload that to YouTube, if you could just send me the link, then I can forward that over to Kimmy in the email that I send her. Cool.
Sounds good.
Awesome. Thank you. Thank you so much, Courtney. Thank you, Rachel, for making the time to talk about all of this very exciting procedural stuff.
Sure. Thank you.
All right. Take care, Bree. And Bree, you and I will be in touch about other things. Okay?